Hi, welcome to the ZP Developer Zone. So we do this Developer Zone every Thursday at 8 a.m. London time. We've gone a little bit early today because there's a lot of vacation going on in Europe, and we've also got a lot of content. So I apologize for that. We have gone 45 minutes early, but this webinar is always recorded. So I hope that if you come in at the, let's say, correct time, you will still get the recording will still be up there. So let me go quickly. We've got lots of questions. As I say, it's a sort of bit of a vacation time in Europe at the moment, so it's disrupted us a little bit. We've started slightly wrong time. So every week I put this up. We do have our ZP Academy, so I suppose I should remind it because we do have some fresh questions that have come in this week. I'm thinking about people who've got questions around cortisol and CGM. We do have our ZP Academy. There are 2 free courses, at least, on the ZP Academy. Introduction to biosensors and electroanalytical techniques for biosensor developers. I suppose I should also say that our YouTube channel as well also does have some quite good videos, a long webinar on wearables. There's one on really sort of deep not deep, but things like cyclovoltammetry, etc. So we do have some good stuff on YouTube as well. We do our webinar every Thursday at 8 a.m. London time, and the webinar is really designed to say, okay, you've got questions. Maybe the person has a background in academia, and so we want to be able to kind of support our colleagues, for example, in academia, and we'll, try and answer some questions there. We've also had some more questions coming in from YouTube, and I will just cover those as well. We do have collaborations. Collaborations strictly mean often with academia. People like to sort of broaden that definition of collaboration, but, it's academia, and unfortunately, because of the funding, it does tend to happen these days a little bit more in Norway and UK because there is always funding in place in those countries for companies like us. We do offer jobs. We're actually recruiting at the moment from USN in Norway. So USN is a local university to us. They do have a course called SSI, Smart Systems Integration, and we do recruit a lot of the international students from there because, to be frank, they're excellent. I'll go a little bit quicker now. We do have our ZP Developer Zone, and importantly, we do have our workshop. People will sort of say, give me a deep explanation on this or this. And I say, wow, we really do cover this in our workshops. So every month, and I've got a slide on this, every month, we have at least 2 workshops, and I'll just cover that quickly. So regarding workshops, really, if you want to understand at a deep level electrochemical IVDs, in vitro diagnostics, if you want to understand wearable biosensors, then the workshops are really quite good. So we do, we're in April at the moment, so we do have a workshop, for example, next week in Coventry in the UK. So the second week of most months we do a workshop in Coventry, and the first week of most months we do a workshop in Norway. The Coventry one tends to be a 1-day workshop, and the Norway one tends to be a 2-day workshop. Questions that I want to cover today are around CGM, continuous glucose monitoring, which is covered really well in our workshops. I want to cover nitric oxide sensing, NO sensing, and this is in the liquid phase as opposed to gas phase. We have discussed gas phase as well. I think this is a question that's also come in about the PEC2 cell. So we do tend to focus on things like glucose sensors and cortisol sensors, nitric oxide sensors, but we do have a small sort of stream of technologies in photoelectrochemistry, and the PEC2 cell is that, and I will cover that today. This is a question, one of my favorites that came in from, I think it was via the YouTube channel, that people asked a question about identifying elements in their ore, and I will cover that. A question came in about microneedles, I will cover that. A question about measuring pH and oxygen in soil, and I will cover that. Are our sensors verified for cell culture medium? The quick answer is they get used by researchers in cell culture, but we haven't done enough work to sort of verify them for cell culture. I sort of bring that up because there's some cell culture like E. coli, and forgive me, but I think E. coli is actually quite a robust organism. So we've done E. coli work, and we also do currently we're also doing some stem cell work, but stem cells I think, are a little bit more delicate. So, are they verified? No, we haven't sort of certified them for suitable to cell work. We do use them, but the thing about cells is you can't make a we can't make a blanket statement around that. Somebody did ask about metal oxide modification of electrodes. I mean, this is fairly straightforward, and we will cover that today as well. I'm also getting a question here: how to set the input voltage with Easy Flex. I think I recognise the questioner. I think we're actually going to put something out in the public domain. I've got a meeting next week about putting some code out next week in the public domain. But with that question that's just come in through the YouTube channel, if you can put that into the Contact Us page, I will bring that to the webinar next week. Question number 9 here is Streptavidin, the modification of the electrode. But the reason I just noticed that a question came in live. So if you want to change the voltage on Easy Flex, we can do that in the webinar next week. And also, I think we are discussing putting the code base into the public domain as well for Easy Flex as well. So that is an ongoing discussion at ZP. Question number 1. We were asked to really sort of deep dive into our generation 1 and our generation 2 glucose sensors. It's probably, if you see a link pop up at any point, then that's me highlighting some kind of background information or something that's useful. So generation 1 glucose sensors, generation 2 glucose sensors, big differences. Generation 1 glucose sensors use oxygen as the mediator. That's really similar to Dexcom and Medtronic, and generation 2 uses a mediator rather than oxygen for shuttling electrons, and that would describe Abbott's Freestyle Libre 2. As I say, if a link appears, then that really is highlighting the fact that there's some useful information there. This just highlights that we do have a workshop in Norway on the 3rd and 4th of May. It's literally just under a month away, and I would strongly suggest that the person does come to that. I will touch upon non-invasive glucose sensing today, or at least some non-invasive technology. So they want to know about generation 1, generation 2, and non-invasive. Most of the sensing technology today I'll show is generation 1, but we also have some generation 2, and we do cover it quite a lot in our workshops. In terms of configurations of CGM, when I say CGM as well, I could also change that word to cortisol as well. We do have these kind of wire sensors. That's very much like the Abbott Freestyle Libre 2. We do have microneedles. This is, for example, BioLink in San Diego are very keen on microneedles. We do have some quite nice technology or data actually on sweat analysis, but the sweat analysis that we've been doing, or on skin non-invasive analysis, is on lactate. Though I have seen some, it's not clinically proven, but I have seen some work of recent from a good source that people are trying to now think about measuring glucose in the sort of film on skin. But I think that's quite a challenging, clinically hard thing to prove. But these different configurations, be it wire microneedles, be it on skin sensors, or finally implantable, is something that we've done at ZP. These are all ZP images, and something that we do quite a lot of. On the implantation side, we've put some millions into actually CGM, continuous glucose monitoring, over the years. And one of the programs that we have on at the moment is probably one of the most challenging ways of measuring CGM is actually in fish. So we have a sensor, I'll talk about the package in a minute, and we're measuring the glucose and the cortisol in fish. Measuring glucose and cortisol, for example, in fish, it's all the same technologies that you would otherwise use in mammalian applications, including human health. But the nice thing about fish is things like the FDA approval are a lot more straightforward, let's say. So at ZP, we're contract developers, contract manufacturers of things like CGM and cortisol. And one of the sort of public pieces of work that we can discuss is actually this fish technology. This is the technology itself. This is a package that gets embedded into the fish, and as I say, it can continually monitor glucose and cortisol. What I always like about this kind of technology is the sensor is actually, the sort of sensing tip is absolutely tiny, and then the rest of it's just the engineering that it takes to do that kind of work. So we have the sensor, batteries here, the electronics, the encapsulation. I mean, even that, when I look, and there's also a transducer there for sending out data as well. So it's really the engineering that's the big part of this, and the actual glucose and cortisol sensors are actually quite tiny. What's really quite nice is this is a slide that I took from one of our workshop. As I say, we do these workshops. I think if you really want to learn about CGM, I think the Norwegian workshop is the best one. That's the 2-day workshop. Everyone gets to make a glucose sensor, by the way, and everyone gets to make an oxygen sensor, etc. But what we're showing here is that even though these electronics now are sort of the size of my thumbnail, we're comparing data between an R&D piece of equipment, which fits in my hand, to some data that's gathered on a PCB potentiostat that's the size of my thumbnail, and we get exactly the same kind of signal. So it makes very little difference, or no difference, I would say, to shrink the electronics down. That's one of the powers, I would say, of electrochemistry. What we're quite good at ZP is also what we call MVP, minimally viable products. That we do have a whole bunch of biosensors on our website, from glucose, testosterone, lactate, cortisol. We're really good at sort of at least getting them onto the human being. Sometimes the quality of the data is a problem, because once you start wearing sensors, you get all sorts of artifacts in your data. But we're pretty good at translating our sensors into what we call sort of MVP, minimally viable products. You know, putting the kind of support engineering like Bluetooth around there, doing the app development, and we also have a proprietary database called Julie. Julie is where we can essentially stream data up to our cloud, and then from there people can pull that data across to their own applications using API and application programming interface. I just want to answer the question as well. I was just thinking about the question that came in during the YouTube streaming. I'm pretty sure that in the EasyFlex manuals there is instructions in there. We've got a lot of material on the website about setting the voltage. I'm pretty sure it's there as well, but if you bring that question through on our website, then it'll remind me to cover it next week. So we're pretty good at MVPs and sending that kind of data to the cloud, and it's something that we sort of do as quite a regular routine. This is just some glucose data. It's actually lab data where we're just challenging the glucose sensor, and we get this increase in signal with glucose concentration. A lot of our capability of producing at least MVP, minimally viable products, we kind of call it our ZP accelerator. So we can kind of take our sensors, put them in with the appropriate electronics, have Bluetooth connectivity to our to Androids, for example. Android phones or smartphones are great because then they give us connectivity to our cloud. We can get the data up to the cloud, and if we're doing development, we can also then use sort of technologies that are already on the market to give us a reference signal or reference value, and that really helps us with our development as well. So we're really set up at ZP to be able to do this rapid development and of course rapid manufacturing. I haven't really said it, but we're actually, we are ISO 13485, so we do a lot of this as contract work as well. We have lots of configurations of these kind of sensors. We have these wire sensors. This is the kind of, a wire sensor is a sort of transdermal sensor that kind of goes through the skin. And as I say, that's really similar to the sort of CGMs, the continuous glucose monitoring that's on the market today. And we do have a lot of microneedle technology. This is kind of much more next generation. People are very interested in microneedles, both for drug delivery, but also as biosensing platforms. And so we do have these kind of microneedles that are sort of long enough and sharp enough to go through the skin and to allow us to essentially have an electrochemical sensor underneath the skin trying to continually monitor the glucose there. So we've been doing this for quite a few years. I just threw this up quickly as well, that there's a bit. I'm having a bit of a side conversation with a guy online at the moment about Easy Flex. Easy Flex. We've actually gone on to some, for us, some sort of technologies that we do want to go forward with. So on electronics, we do make our electronics available through the web store. If you're much more of an engineer, then I would suggest these electronics these days rather than our Easy Flex. This is, how would I put it, much more modern and something that we're sort of actively using ourselves. So for those who have an engineering background, then these links, by the way, if a link pops up, like I say, I have put it underneath the video already. Question number 2 was around nitric oxide sensing. So let me just remind myself. So somebody, if somebody doesn't have a constant chloride concentration in their sample, then we do these chloride resilient sensors. Amazingly, despite being one of the inventors and an owner of the business, the chloride resilient sensors, the thing about them is that the chloride resilience only lasts a certain amount of time, because we're essentially sort of fixing the chloride concentration in that sensor. But the reservoir of chloride on that sensor is quite, is limited, and it's exchanging with your sample all the time. So chloride resilient sensors, we use them at ZP, but we sort of use them understanding the limitations of them as well. But in some ways, in the end, we make them with and without chloride resilient electrodes. Unless I'm doing that experiment myself in that lab, I can't, and absolutely knowing your timelines, it's really as hard for me to sort of say, yeah, use that sensor or use that sensor. But we do have these chloride resilient nitric oxide sensors. Every time every time a sort of link pops up, then I'm trying to link to something. You can use them with PalmSense. We are because we're releasing our own range of potentiostats, and I have a sort of quick link to that. We're sort of in a transition period that reluctantly we will support people's use of the PalmSense, but we will eventually then go over to our own potentiostats. You will need a connector if you're going to use our NO sensor, and so if you're using PalmSense, then you'll probably need a 7mm SPE, which takes 2mm banana plugs. I'm pretty sure if you look at the banana plugs on your PalmSense, they're 2mm. Our sensor, so we have a connector that goes between PalmSense and our electrodes. Many of our electrodes have a width of 7mm, so that's why we call it. It's not very inspired, the name, but the 7mm SPE to 2mm banana plug connector. And I have put a link to that as well. Good. So that means I probably have pasted it already underneath the video. If we at ZP, we will do quality control on these nitric oxide sensors before they go out. Obviously we want to know that they're functioning. So we will do that, but that test by us is not sufficient for you to just use our calibration. Unfortunately, you do have to use your own calibration, because in every let's say sample type, you essentially, if we make a glucose sensor, for example, for urine, or we make a glucose sensor for blood, it's a different calibration. Now, in your kind of work, with cell culture, if it is cell culture, that is, every cell buffer or matrix, you'd have to calibrate in that. So we would calibrate in our test solutions, but unfortunately you do have to calibrate in your test solutions as well. They do ask here whether they can use an NO donor. The quick answer is we do use nitric oxide cylinders, but we also do use NO donors ourselves. And they say here, can you order with the sensors? The quick answer is I've intended to actually do that, but I haven't done that as of yet. I did make this comment that we've historically been supportive of the PalmSense potentiostats, but as we are launching, with good reason as well, we are ISO 13485. It means we have to really control. We do a lot of testing in our lab, so we really need to control our electronics to make sure that the results coming off there, we've got to make medical decisions on these results, so we really need to control those electronics. So we have made a R&D potentiostat. We make it available. There's a link here to the R&D community. It's pretty good, actually. I mean, there's it's next to my hand there, so it's a little bit obscured, but the potentiostat, which is actually much, as you can see, much smaller than the laptop itself, is a 6-channel potentiostat. So that's pretty good. Now, the reason that we've kind of gone for 6 channels is, I think when you've got a 1-channel instrument, it sort of insinuates that you do one test at a time, but there's never enough data when doing one test at a time. So we're pretty keen on doing, lots. Unfortunately, we do lots of, not unfortunately, it's just a statement of fact. We do a lot of testing, and we need to be doing parallel testing. So 6 channels for us is almost like a minimum. We're obviously going to 96 channels so we can get a lot of data. The PEC2 cell, I have mentioned it, that I'm just coming slightly off now biosensing and actually talking about photoelectrochemistry. We did have a question because we did put a video up of recent about photoelectrochemistry. There's something called the PEC2 cell here, which basically allows us to shine light into a solution and do things like photoelectrochemical experiments. The person was just asking where can they clip their potentiostat to the working electrode. I did find this paper actually on ResearchGate. That's why I've kind of, there's the title. This is their drawings. I'm just saying you actually just clip on the front here. This is where the, essentially, if your working electrode is the transparent electrode, then you would essentially clip on there. I'll go quite quickly because it's quite straightforward. This is a question that came in through YouTube. So of recent, we were asked on YouTube about how do you detect metals, and of course, being sort of scientists, well, that's an interesting question because we cover the fact that we have ion selective electrodes. So if you want to know potassium, calcium, sodium in the blood, for example, then we have our ion selective electrodes. I have linked to that previous video here, and I also have put that link underneath the video here. We also talked in that video about how to detect other metals like copper and lead. We also talked about some of our hardware platforms as well, something called Sense It All. That Sense It All just allows us to very quickly take nice concepts and actually make them into tangible, minimally viable products as well. But this person actually, I sort of read their question carefully, and I kind of thought, if I explain what I think they're asking us, it's like, I have some ore here. In it, I suspect that there's something like platinum, and how can I tell in a sort of non-destructive fashion how much platinum is in there? So I've linked to a PDF here because I sort of knew the right question. The question is how can I take a sample of ore and know how much, for example, in this case, how much platinum is in there? And I kind of just had a little think about it and thought, right, well, the technique is going to probably be X-ray diffraction. X-ray diffraction essentially fires X-rays at a sample. The X-rays diffract or sort of go in different directions. The angle of that diffraction tells you about the elements, or the crystals, I should say, causing that diffraction. So it's the closest technique I could think for sort of non-destructively looking at a sample and actually be able to tell that it's platinum. And then I kind of Googled around those ideas, and of course, lo and behold, there's some sort of scientific, article about this. So I always like the fact that there's, as long as you know how to answer the question, there's always, in this modern day, there's always an answer out there. So the answer is XRD. The kicker is, this is possibly done in industry, but it's a very expensive technique. But there is no magic technique. You're sort of asking the question, how can I look at this ore and know how much platinum is in there, for example, or gold? But actually, there is a technique for it, X-ray diffraction. But I suspect that I know the kit will be very expensive. I know the throughput, how much you can test per time, is going to be quite small. And I know that the interpretation of the signal could be quite hard because, if you're sort of making these numbers up, but let's say it was 48% gold, that means 52% of it is not gold, and, it can cause you interferences. But I have posted this PDF link underneath this video, and I hope that kind of helps you. This question 5 was independently asked about microneedles. We do have a whole, how do I put it, bunch of microneedles. this is the product we sell. So the product does come mounted on the PCB. The PCB then allows us to sort of connect. I think the width of this is 10 millimeters, so this will connect to our potentiostats. We do have a connector. I would call it like the 10 millimeter SPE to, and then that connector can go to banana plugs on potentiostats, depending on what potentiostats you actually have. But we do that as an entire unit. We don't do the PCB separately. We just do it as an entire unit. This is an interesting question. What's the service life of the microneedles? Something that, is something I've talked about in the past is people don't guarantee wetted parts. What I mean by that is, if you make a scientific device, you can often have a piece that is wet, in wet contact with a sample, and pieces that are not in wet contact with a sample. So let me describe a spectrometer. A spectrometer might have a cuvette in it. The cuvette is a wetted part. People won't warranty or guarantee that. And why is that? And that's because they essentially can't guarantee what's going onto that sensor, so they won't warranty or guarantee it. Whereas the spectrometer itself, which is not in direct contact with the sample, that will have warranties and guarantees associated with it. So what I want to say is, these microneedles, we use them a lot, and we put them onto, onto pigs, etc., and they kind of stay on for 3 days. It's all very fine, but I want to give you a warning that we won't warranty you and guarantee it, because we can't be guaranteed what you're actually going to do with it. So be careful with wetted parts. You have to treat them. I mean, if you're treating them quite gently and using them in PBS, etc., phosphate buffer solution, then you should get away with it. But a real manufacturer of devices won't guarantee or warranty wetted parts, because we really can't guarantee what you're going to do with them. Question number 6 is around about measuring oxygen and pH in the soil. I should have really put links to these products, actually, because I realize we do have a dissolved oxygen and we do have a pH sensor. It's probably worth, it's just a side note really, that actually at ZP we do have a soil test laboratory where we actually have soil and we put our sensors in there. I suppose I should back up slightly and say that we do have a dissolved oxygen sensor and we do have a pH sensor, but we've not tested them in soil. But we have unusually the capability of actually testing in soil. And we did a lot of work with PCB. Is it PCB? We did a lot of work with a company called Plant Biosciences Limited in the UK about putting biosensors actually into, for example, soil and agriculture type applications. So we do have a lot of experience with that, but we haven't specifically done the pH and dissolved oxygen in soil, though we have worked on analytes like nitrate in soil. Slight side note here, actually. I hope that we had an inquiry from India this week asking about electronics on cortisol. I hope they're actually watching this part because of the webinar as well, because what I'm showing you here is a technology that looks extremely different from CGM, from continuous glucose monitoring. But it's continuous monitoring. It just happens to be in soil. But the whole platform of technologies about sensors, about telemetry, about cloud, about Android app, it's all the same technologies. The nice thing about the soil work that we've done in the past, as I say, we did this in conjunction with Plant Biosciences Limited. We did actually end up taking those sensors out and actually putting them in the soil. This was specifically nitrate, and we measured nitrate in the soil for, I don't know, something like 3 months. It was absolutely, it was great, to be honest with you, and we got some really nice results. But the quick answer to the questioner's question, which is, can I use these in soil? We literally haven't tested them, but we have the capability of testing them, but it would have to be as part of some sort of project. Question number 7 is interesting, actually, because it's sort of, it reminds me a little bit of one of the questions earlier on about nitric oxide. Are our sensors verified for cell culture? So there just said, for example, ATP, this is the adenosine triphosphate. This is kind of the currency of energy in cell. Hydrogen peroxide, NADH, this is reduced nicotinamide, calcium. Are these sensors verified for cell culture? The quick answer is we haven't verified them. We do use them. We have a a PhD at the moment using some of our sensors in cell culture, but it is too premature for us to start. They need to have the right to publish before we start talking about it, if I can put it that way, in the public domain. What I can say is, and I will have a link on this, is the ATP sensor. We have something called a microsensor, and that is actually used a lot in biology or neuroscience. So I do have a video on this. I'm also going to put a link in a minute as well. So the ATP sensor, but that's in the microsensor configuration. So we found at least 36 scientific papers where they are using the ATP, the adenosine triphosphate sensor. I think the reason that the neuroscientists essentially get away with it is because the microsensor format is so small that it hardly causes any kind of disturbance on the cell culture or the tissue culture in that particular case. But tissue is just a whole matrix of cells. So we do have some evidence that the ATP sensor is in particular okay, but we don't have a lot of public domains to say that this is going to work, no problems in your cell culture. I think we kind of have a sort of buy and try policy. We try to make our sensors available so people can actually buy and actually try out whether it is going to work. I'm not even sure how long I've been talking for now, but quite some time, I would say. Yeah, 31 minutes. Like I say, if you've come in slightly late this morning, I apologize. Not late. If you came in at the right time, we did start early because it's public holidays in the UK. So, metal oxide modification of electrodes. How do I modify my electrode with nanoparticles, for example, of metal oxide? Maybe even come through YouTube. Take your screen printed electrode, for example. This is one of ours. I've put a link here. I'll put a link here because you can see how low cost they are if you actually find that link underneath the video. We literally just cast down a solution of the nanoparticles. I make a point of just making sure that we just cover the working electrode. We don't splash it all over the reference or all over the counter. Keep the material in place. So we literally do, if we're doing small scale work, we'll hand pipette it onto there. And people say, oh no, it's too hard. It's not too hard. Every time we have a workshop, we all hand pipette and we can all do it. So I think, anyway, hand pipette down like that. Let the solvent evaporate away and then you're left with nanoparticles on the surface. I think we don't do metal oxides quite so much, but we have done nanoparticles quite a bit. So nanoparticles, I think, is the real secret. This is a tricky one for me, actually. Modifying gold electrodes with Streptavidin. Or I did ask, and I was a bit surprised because I thought we had, but we don't seem to have used Streptavidin, at least of recent. But when people are talking about Streptavidin, they're often talking about making kind of immunosensors. So we do have a really good gold electrode, and we do use it for making immunosensors. I want to say a fair bit. How to build a sensor for proteins. So what we would do, I will talk a minute about actually making sure that gold surface is clean. But we'll obviously take a gold electrode. We'll functionalize it with. We'll often use self-assembled monolayers. We'll use some sort of we call them SAMs, obviously self-assembled monolayers, which often have a kind of a sulfur atom on one end and some sort of functional group on the other end. Until that, then you can call that functional group there Streptavidin, for example, and then we can sort of connect antibodies to the surface that way. And then we use a blocking agent to stop what's called non-specific binding. But what's important is we actually follow these processes quite a lot using cyclovoltammetry. So we will do a cyclovoltammogram in something like 5 millimolar ferrocyanide, get a CV, make sure that everything is good. And then every time we do a functionalization, we recheck some of the electrodes, again with this ferrocyanide solution. Because if we don't see a distortion in the cyclovoltammetry, then we don't think that we've actually functionalized. I'm sorry, just reading a question. I'll read that question in a minute as well. So we do measure these processes as we go by cyclovoltammetry. I think one of the things that people don't necessarily realize, I do try to emphasize it a lot on our website, and also a lot in our at least in our webinars, is gold electrodes, no matter how nice the manufacturer has made them, you often do need to clean them before use. We do have some cleaning solutions on our website, and also some rinse solutions, but what I'm going to say is you should have some fairly nice CVs, cyclovoltammograms, on your gold electrode, which you've measured using ferrocyanide, before you start the process. And the reason, and the way you get a nice CV is, if the cyclovoltammogram is looking distorted, then it tells me that the surface is tarnished, and gold is very good at tarnishing. It just tarnishes just by, I think, absorbing materials from the actual atmosphere. So it does need, we kind of call it activating, but you could call it cleaning. And we actually clean the surface just before use. So we do have a cleaning solution for this. If you want to make a homemade cleaning solution, I can't tell you our formulation because it's proprietary, but how do I put this? Use some very mild acidic materials, but make it mild. What I'm concerned about is you've got silver chloride around this electrode, so you've got to be careful, because you can end up dissolving some of the silver chloride and actually depositing it on the gold electrode. So we do try to clean the surface itself and not try to splash lots of material all around, otherwise you'll end up just contaminating the electrode. So we have a rinse solution, and we also have a cleaning solution. If you want to make some homemade stuff, sort of essentially Google cleaning gold electrodes, but try and make it a little bit mild. I'll do a quick run through the questions, and then I'm just going to take a quick look at one of the questions that's coming live at the moment. Question number 1, continuous glucose monitoring. One of the best ways of actually understanding our technology, the technology landscape, the technology of other people, is to come to our workshop. That nitric oxide sensor, I think you do need a connector. I'm being a bit hesitant on whether you need or don't need that reference electrode. I honestly think you have to try it, unfortunately. And yeah, you can in principle use a an NO donor as opposed to NO gas, because we do use on occasions NO gas and NO donors, and they both work. Our testing in our laboratory before we ship is not, that calibration is not necessarily going to hold true for you in your solution, so I'm sorry about that. That PEC2 cell, there's a little black connector at the front which you can crocodile clip onto. Elemental analysis of ores, it's X-ray diffraction, XRD. Microneedles, they're available on our website, and I can't really tell you the lifetime of them because it depends what you use them for. The pH and DO, I think I'm saying we got the pH and the dissolved oxygen, but they've not been verified in the use of soil. Our sensors for cell culture, no, they're not verified for cell culture. We do use them in cell culture, but I definitely haven't verified them for the cell culture that you're doing. It's worth taking a look at one of the links. It's just interesting to see how the neuroscientists are using them. This metal oxide modification of electrodes, dissolve up the metal oxide nanoparticles in a solution, pipette that onto the surface of the electrode, let the carrying solution evaporate away, and you're left with nanoparticles on the surface. The Streptavidin modification of electrodes, I must admit, I thought we would have had done this work, but I had a quick ask around, and we haven't of recent at least done it. First of all, make sure that surface is clean. I know that we will have shipped you pristine electrodes, but just the transportation of gold electrodes, we always activate these things before we use them. I've got a couple of videos in there, but try and make sure you get a decent cyclovoltammogram before you even start the whole process of trying to modify these electrodes. And as you modify, we actually do test them again with cyclovoltammetry and ferrocyanide to make sure that we've actually have modified the surface. I can see a few more people have come online now, so I apologize that I did start early today. Like I say, it's a public holiday in the UK. Now I'm just going to slightly switch because I just want to have a quick look. How do I set the input voltage with Easy Flex? This is a quite slightly hard one for me because I might have to, I'm just going to very quickly change gears slightly because I'm being asked live a question and I'm going to try and answer it live. So now the Easy Flex, I've talked a lot about wearables today, and I've also given some distinct links to products that I am suggesting. But the Easy Flex is something that we've had around for about 5 years, in fact. It's not something I push particularly heavily these days. In the past, we would have been more keen on it, but to be honest with you, the chipset, we found something that's sort of more, let's say, useful. So we have a quick start guide here, SPI data protocol, Bluetooth protocol, a data sheet, and a poster. I'm just going to have a quick look at this quick start guide. I understand the question, by the way, which is this person wants to, yeah, you can set, this talks about it here, in fact. I think you can set the voltages. So the question is, in amperometry, the input voltage should be applied. I agree. The full, and the latest platform application doesn't. Right, okay. All right, well, they've got a question that they say that they can't set the input voltage, which I'm a little bit surprised about. I generally think you can, actually, but put that question into contact us. And if you just paste it in here, and I will either get a video made, or I may find that a video already exists, but I'll also get that, essentially get that code checked to make sure that actually it can work. Because I can see we got the software here. I can see that, so we do have the software, so I'm a bit surprised that it doesn't, but post a question into the contact us and I will deal with your question. So let me just say thank you for all these questions. I know I've been speaking for 42 minutes and I apologize for that. And I know that some of you are only just coming on live now, but rewind, go to the beginning, and I do cover all the questions in real time. My colleagues who are asking about CGM and cortisol sensors, CGM and cortisol do appear an awful lot during the webinar today. And can you update the documents as well? I could, like I say, the Easy Flex is a kind of end of life product for us. I would say that we're actually Easy Flex is something that we did probably put together. Something like 5 years ago, and these days we're actually going on to onto how do I put it, onto a new product, which I will very quickly bring up. So if you go to Zimmer and Peacock, I'm just answering a question literally in real time at the moment. So if you ever Google single purpose biosensor circuit, then actually this is the guy that we're doing a lot more support on these days, because this is the product that we're very keen to go forward with, and I've got a bit of a data sheet on that as well. In fact, I would describe that as even more comprehensive. So let me say thank you very much for attending. My apologies for starting the workshop particularly early this week. Like I say, it's a public holiday, and but of course we will always honor the fact that we'll do our workshop, and we did do it, but we just did it a little bit early, or the webinar I should say. So please have a good week, and we'll do our webinar on Sundays, which is just a roundup of the news for this week. Otherwise, if you've got any questions, put them in the contact us here on the website, and we'll be happy to try and answer them next week. Okay, thanks very much.